Hi, I'm Christine Randazzo-Kirshner, GI expert dietitian and the co-founder of Immense Nutrition.
And I'm Ronit Zukanik, a pelvic floor physical therapist and founder of Foundations Physical Therapy.
And Ronit is going to show us today how to do diaphragmatic breathing.
So first, I want you guys to sit down, find a nice comfortable seat, making sure that your feet are nice and on the floor and you have some back support. And then I want you just to kind of close your eyes, place one hand on your belly, one hand on your chest, and just breathe. Notice where your breath is going, how fast you're breathing, and we're going to work on both of those things. So the first step is I want you to move your breath from this upper chest breathing that Christine is doing, and probably you're doing as well, into that bottom hand so that your belly is expanding as you inhale, and then just coming back down as you exhale. And you're not going to be pushing your belly out as you breathe in. You're going to be releasing and relaxing the muscles of your abdomen so that more air can enter and your belly will just expand outward.
So don't push out, just focus my breath there.
Just focus your breath there.
Okay.
Focus on just keeping it nice and relaxed into your hand. And as you're doing that, you're going to start to notice that more movement is happening on that lower hand, and hopefully less movement is happening on that upper hand. And that's what you're going to try and accentuate as soon as you start to notice it. And then we're going to work on slowing your breath down a little bit and making these breaths nice and long. So I want you to focus on that inhale, to inhale for 4, 3, 2, and 1, and then hold your breath at the top for 2 seconds, and then exhale for 5, 4, 3, 2, 1. And again, inhale for 1, 2, 3, 4, hold for 1, 2, and exhale for 5, 4, 3, 2, 1. You're inhaling through your nose nice and slowly for 4, holding your breath at the top for 2, and then exhaling out a relaxed mouth for 5, 4, 3, 2, 1. And you're going to repeat this for 5 to 10 minutes. And hopefully as you do it, it starts to get easier and easier.
Yeah, it'll take time, especially because you won't be used to it, and so it'll take a minute to get into that relaxed phase, right?
Yeah, because some people can make you feel a little lightheaded, so make sure that if it does, just take a break and come back to it later.
Great. And Ronit, as a pelvic floor physical therapist, and me as a GI dietitian, we both actually use this in our practice a lot.
Yeah, absolutely. We use this for patients who are in pain, who are anxious, really for any of their bowel, bladder, or even sexual symptoms.
Yeah, and as a GI dietitian, I might be working with Ronit. We might be sharing a patient, and we want to have continuity and have patients be doing similar therapy so that they can reach their goals. And so I'll be using it with patients that we might share. I also help it for patients that are anxious in terms of like re-regulating the gut-brain connection, as well as we have a lot of patients who come to us with food fears and they might be anxious. And so doing some diaphragmatic breathing before you eat, while you're eating, after you're eating can be very helpful for these patients as well. Diaphragmatic breathing really can be helpful just for stress management, like in general.
All of us.
So you have it here. We're going to get a comfortable place to sit. We're going to inhale for 4 seconds, hold your breath for 2 seconds, right? Exhale for 5 seconds. You'll have a hand on your chest and your belly so you know where to focus. And then you repeat that for 5 minutes, 10 minutes, whatever makes sense for you.
Absolutely.
Okay, so go ahead and practice your diaphragmatic breathing.